Thank you, Governor. Good afternoon, everyone. Looking at our data, where we always want to stay grounded and start with, we have 318 new cases to report out of 19,275 tests, which is a percent positivity of 1.6%. That continues to lead the nation in terms of the testing that we have been able to maintain. And as I had said several weeks ago, with that confidence, we know that that's how we can build out the strong vaccination program that we have as well. We have 114 people currently hospitalized. We saw a small increase in our number of new hospital admissions over the last week. And sadly, we have 2 new COVID-19 fatalities to report. The importance of sharing our condolences with the families of these Rhode Islanders is a critical reminder for us that we have to stay vigilant. Tom McCarthy will give an overview of where we stand with our vaccination campaign operations, but I want to really echo the sentiments that have been stated about where we are and what it means from our vaccination campaign standpoint. It's important to know that the moves we are making are based heavily on what we feel we can achieve together with getting everyone vaccinated. That protection from being vaccinated makes all the difference in the world when it comes to reopening our economy. Last week, we shared 2 target dates in May and June as key milestones for vaccinating 70% of our eligible population and then 70% of our population overall. Because of the strong work we have continued to do in terms of vaccinating, we feel comfortable announcing that those dates have been moved up 1 week a little bit earlier in May, because we're continuing to push hard on vaccination. And I want to spend today really helping to make sure you understand the responsibility that's in place for protecting yourself, your loved ones, and your household. I do really want to emphasize that the changes the governor referenced and that Secretary Pryor will be sharing in more detail, these changes are really geared towards people who are fully vaccinated. By fully vaccinated, I mean you've had all of your recommended doses for vaccination and 2 weeks have passed since that time frame has occurred. The key with that is when you are fully vaccinated, that's when you can have the protection and confidence in being able to go out and enjoy as our economy is reopening. What we're doing today is making clear that we're moving away, we're slowly shifting from the requirement in the environment realm and moving towards the realm of personal and family responsibility and accountability, and making sure that you are equipped. We know the testing that's available for everyone. We know the vaccines that are available for everyone. We have reached a milestone. 500,000 Rhode Islanders have received at least 1 dose of a vaccine. That's tremendous. It's a huge credit to the entire team. We know the vaccination team is still being run directly through the Rhode Island Department of Health, and there is an amazing statewide effort that's there to support that. But there's more to do. And we recognize it's time for our businesses to continue to get some relief. The governor has said continually, we want to make incremental changes. So we're at a point of being able to do that so that we can support our businesses and help to make sure that you and your families are informed about how you can continue to protect yourselves. There's some key messages with making that shift. Key is knowing outside is always better. Take it outside, go to restaurants outside, stores, flea markets, exercise outside. Coronavirus does not spread as effectively. Outside is a lower risk. Whenever you can take it outside, do that. Avoid crowds. Make sure you continue to wear your mask. The governor is leading and ensuring that masks, particularly indoors, continue to be required. Stay home if you're sick. And based on the dates that we're sharing, do everything you can to get fully vaccinated. Any of these reopening criteria that we are sharing today are fully intended for individuals who are getting fully vaccinated. We want to make sure that we're continuing to be clear about that, because the changes that we're making and supporting businesses but still ensuring that you are informed is because the virus, the science of the virus does not change. The public health elements of how coronavirus spreads does not change. If you choose to go within less than 6 feet of someone for a sustained period of time, regardless of what the requirements are in various settings, your risk for coronavirus is higher if you are not fully vaccinated. This is where personal decision comes into play, and we've been together long enough that we are confident that you have the information you need to make the right decisions that you need to make. If you're not vaccinated and you show up to a church or a store or the gym and it's really crowded, you should think twice about going inside. You should think deliberately about going to get vaccinated so you can enjoy some of those things. We're supporting and going to be working in partnership with Secretary Pryor with businesses to be able to proclaim employees are vaccinated. We have good ventilation. We're working hard to make sure that you are safe. This is a safe place to shop, a safe place to eat. And we want to make sure everyone has the information that you need so that you push yourself and your family members to go get vaccinated. The COVID-19 landscape today is not what it was a month or two ago. Every day that you don't get vaccinated, your risk of getting COVID-19 becomes higher and higher. Anyone who's starting to embark on these activities as we're reopening and you're not vaccinated, engaging in any of these activities are high risk. They are intended for people who are fully vaccinated to be able to really enjoy and be confident that their risk for spreading COVID-19 is low. It's key to know that you want to get vaccinated even if you have had COVID-19 in the past. We know that vaccines lead to very strong protection from infection. And the variants are circulating. So even if you have been infected and developed immunity from one infection, it may not involve good or adequate infection with a different variant. The vaccine has been able to show its effectiveness. It may differ a little bit, but it is effective in protecting you against these variants. And the variants are continuing to spread. So the more you are out there and not vaccinated while people around you continue to get vaccinated, the variant coronavirus is looking for the people who are even more susceptible. So the quicker you can go to get fully vaccinated, the quicker you can be confident that you're going to be protected. Particularly with knowing that our children do not have access to the vaccine right now. So if you have children in your family, children around you that you're exposed to, you getting vaccinated helps to protect them. People are going out more now and into stores and into restaurants and playing sports. We need to make sure that those who have access and are eligible for vaccination, go to get fully vaccinated so those who are around them, whether they are immunocompromised or whether they are the children in your life that you love, the best way to protect them is for you and your loved ones around them to get vaccinated. And if you're going out into the public, you want to make sure as many people around you have that protection as well. The key is for everyone. These are the safest things to do as we go forward. I'll repeat them what I said earlier. Doing things outside, transmission is significantly less. Avoiding crowds whenever possible. Wear your high-quality mask, even when you're outdoors, and limit the interactions of people when you're indoors. Stay home when you're sick. And, of course, get vaccinated, fully vaccinated, as soon as you can. If you're thinking about Mother's Day now, know that it will be much, much safer doing it outdoors, wearing your upgraded mask, staying away from crowds, and if you and your family members are vaccinated. We are so close. We want to walk across that finish line with our heads high, standing strong, confident in the tools that we have. We need to remain vigilant and keep doing the basics. The science, the public health does not change. These are the things that are going to allow us to be able to enjoy that wonderful summer that we are looking forward to in Rhode Island.